Question 1. A charge nurse must assign clients during a staff shortage. Which client is safest to assign to a float nurse from pediatrics? A. A client receiving a continuous heparin drip for DVT. B. A client with COPD on 2-liter nasal cannula and scheduled nebulizers. C. A client with unstable angina awaiting troponin results. D. A client requiring titration of dopamine infusion. Answer. B. A client with COPD on 2-liter nasal cannula and scheduled nebulizers. Rationale. The float nurse should receive a stable, predictable client with care needs similar to their usual scope. Options A, C, and D require cardiac or critical care experience outside pediatrics. Question 2. During a mass casualty event, the nurse must determine which client receives immediate attention. Which client should the nurse prioritize? A. A client with an open femur fracture and stable vital signs. B. A client with third-degree burns over 80% of the body. C. A client with a tension pneumothorax and severe respiratory distress. D. A client with a large scalp laceration and controlled bleeding. Answer. C. A client with a tension pneumothorax and severe respiratory distress. Rationale. Airway and breathing take precedence. The client with a tension pneumothorax is an immediate, reversible life-threatening danger. Question 3. The RN delegates care to an LPN and UAP. Which task must the RN retain? A. Administering oral antihypertensives. B. Performing wound care for a diabetic ulcer. C. Evaluating the effectiveness of pain medication. D. Recording intake and output. Answer. C. Evaluating the effectiveness of pain medication. Rationale. Only RNs can perform evaluation and clinical judgment. Tasks involving data collection may be delegated, but interpretation and assessment remain RN duties. Question 4. A nurse suspects that a new graduate is documenting assessments they did not perform. What should the charge nurse do first? A. Immediately report to the State Board of Nursing. B. Collect objective data and discuss the concern privately. C. File a written complaint with administration. D. Ignore the behavior unless harm occurs. Answer. B. Collect objective data and discuss the concern privately. Rationale. Addressing concerns directly while collecting evidence ensures fairness and professionalism before escalating to formal reporting. Question 5. A nurse caring for 4 postoperative clients notes 1 with decreasing urine output, hypotension, and tachycardia. What should the nurse do first? A. Notify the surgeon immediately. B. Check for abdominal distension or bleeding. C. Administer a fluid bolus as ordered. D. Reassess in 30 minutes. Answer. B. Check for abdominal distension or bleeding. Rationale. Assessment precedes intervention. Signs indicate possible internal hemorrhage. Rapid recognition and evaluation of cause ensure timely provider notification. Question 6. The nurse manager is investigating repeated falls on the unit. Which action demonstrates effective quality improvement? A. Conduct anonymous staff interviews to identify patterns. B. Replace all staff involved in fall incidents. C. Document each fall in the charge nurse's logbook only. D. Increase security rounds. Answer. A. Conduct anonymous staff interviews to identify patterns. Rationale. Root cause analysis identifies contributing factors, leading to sustainable system changes, not punishment. Question 7. Which client assignment should the nurse question? A. LPN assigned to administer medications to stable clients. B. UAP assigned to assist with toileting for postoperative clients. C. LPN assigned to monitor a client receiving blood transfusion. D. RN assigned to assess a newly admitted diabetic ketoacidosis client. Answer. C. LPN assigned to monitor a client receiving blood transfusion. Rationale. LPNs may monitor after initiation, but initial observation for transfusion reaction must be by an RN. Question 8. The nurse must advocate for a client whose physician refuses to explain a new high-risk procedure. What is the nurse's best action? A. Explain the procedure to the client directly. B. Ask another nurse to explain it. C. Contact the provider and request they speak with the client. D. Proceed with preparation since consent was signed. Answer. C. Contact the provider and request they speak with the client. Rationale. Informed consent is a physician's responsibility. The nurse ensures the client's right to information is upheld. Question 9. A nurse notices the LPN repeatedly entering a client's room without PPE during isolation precautions. What should the nurse do next? A. Report immediately to infection control. B. Review the policy and provide immediate corrective feedback. C. Ignore if no infection occurred. D. Ask the UAP to remind the LPN next time. Answer. B. Review the policy and provide immediate corrective feedback. Rationale. Real-time correction ensures safety and prevents repeated errors. Reporting follows if noncompliance persists. Question 10. A nurse receives a new admission with sepsis while caring for 3 other clients. What is the nurse's first action? A. Delegate vital signs to UAP while beginning assessment. B. Administer IV antibiotics immediately. C. Review lab results before starting interventions. D. Notify the provider about blood culture results. Answer. A. Delegate vital signs to UAP while beginning assessment. Rationale. Prioritize assessment and delegation. The RN initiates focused assessment while delegating basic tasks to save time. Question 11. Which client can the RN safely assign to the LPN in a mixed skill team? A. Client receiving TPN through central line. B. Client with stable heart failure on oral diuretics. C. Client awaiting diagnosis of meningitis. D. Client newly diagnosed with DKA. Answer. B. Client with stable heart failure on oral diuretics. Rationale. LPNs can manage predictable, stable clients. Central line, infectious disease, or unstable metabolic cases require RN care. Question 12. A nurse manager observes tension between 2 staff members affecting communication. What leadership approach is most effective? A. Address both privately to facilitate conflict resolution. B. Reassign them permanently to different shifts. C. Ignore unless patient outcomes are affected. D. Document the issue and report to HR. Answer. A. Address both privately to facilitate conflict resolution. Rationale. Conflict resolution promotes teamwork and patient safety. Early, direct communication prevents escalation. Question 13. A nurse is precepting a new graduate who hesitates to question unclear medication orders. What should the preceptor emphasize? A. Nurses are legally responsible for verifying unclear orders. B. Only pharmacists clarify orders. C. It's acceptable to administer if confident. D. Documentation removes liability. Answer. A. Nurses are legally responsible for verifying unclear orders. Rationale. RNs hold accountability for safe medication administration. They must question ambiguous or unsafe orders. Question 14. During unit planning, staffing resources are limited. Which client should be assigned to the most experienced nurse? A. Client with uncontrolled hemorrhage post-OR. B. Client awaiting discharge teaching. C. Client with stable pneumonia on antibiotics. D. client scheduled for wound dressing change. Answer: A. Client with uncontrolled hemorrhage post-OR. Rationale: the unstable, high-acuity client requires expert assessment and intervention. Stable clients can be assigned to less experienced nurses. Question 15. The nurse is teaching staff about delegation. Which statement by a staff nurse indicates understanding? A. I am still accountable for the outcome after delegating a task. B. If the UAP agrees, I'm no longer responsible. C. Delegation means transferring all responsibility. D. Supervision is not needed if the task is routine. Answer: A. I am still accountable for the outcome after delegating a task. Rationale: the RN retains accountability for delegated tasks and must supervise and evaluate outcomes. Question 16. The nurse receives report on 4 clients. Which client requires immediate intervention? A. Client post-cab with chest tube drainage of 180 milliliters in the last hour. B. Client with COPD reporting mild shortness of breath. C. Client 2 hours post-appendectomy requesting pain medication. D. Client with ileostomy asking for stomach care education. Answer: A. Client post-cab with chest tube drainage of 180 milliliters in the last hour. Rationale: excessive drainage indicates potential hemorrhage and requires urgent assessment and provider notification. Question 17. A nurse discovers a medication error after administration. What is the nurse's immediate action? A. Document the error in the client's chart. B. Notify the provider and complete an incident report. C. Inform the client's family immediately. D. Wait for signs of adverse reaction. Answer: B. Notify the provider and complete an incident report. Rationale: the nurse must ensure patient safety, report the error, and follow institutional policy without altering the client's chart documentation. Question 18. During interdisciplinary rounds, a physician dismisses a nurse's input on discharge planning. What is the most appropriate response by the nurse? A. Remain silent to avoid conflict. B. Restate concerns using evidence-based data. C. Leave the meeting and document disagreement. D. Request management to intervene. Answer: B. Restate concerns using evidence-based data. Rationale: using objective data supports advocacy and reinforces nursing's professional role in collaborative care. Question 19. The nurse manager receives reports of unsafe staffing leading to delayed care. What should the manager do first? A. Submit an incident report to administration. B. Review staffing patterns and acuity data. C. Reassign nurses immediately. D. Escalate directly to legal counsel. Answer: B. Review staffing patterns and acuity data. Rationale: assessment of objective data identifies the cause before interventions. Quality improvement begins with data analysis. Question 20. A nurse is caring for a terminally ill client whose family demands aggressive treatment despite a DNR order. What should the nurse do? A. Follow the family's request. B. Contact the provider to clarify goals of care. C. Proceed with resuscitation. D. Ignore the family's concerns. Answer: B. Contact the provider to clarify goals of care. Rationale: the nurse must advocate for adherence to legal orders while ensuring the provider communicates and mediates with the family about the care plan. Question 21. A nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with chest pain relieved by nitroglycerin. B. A client post-lobectomy with new tracheal deviation. C. A client with diabetes reporting thirst. D. A client awaiting morning labs. Answer: B. A client post-lobectomy with new tracheal deviation. Rationale: Tracheal deviation indicates possible tension pneumothorax, a life-threatening complication requiring immediate attention. Question 22. A charge nurse is assigning clients to nurses. Which assignment should be questioned? A. A new graduate assigned to a client with a fresh tracheostomy. B. A senior nurse assigned to a stable COPD client. C. LPN assigned to administer oral antibiotics. D. RN assigned to a client with chest pain. Answer. A. A new graduate assigned to a client with a fresh tracheostomy. Rationale. Airway management requires experienced clinical judgment. High-risk clients must be assigned to experienced RNs. Question 23. A nurse witnesses another RN falsifying documentation to appear compliant with hourly rounding. What is the nurse's immediate action? A. Report to the nursing supervisor. B. Confront the RN in front of staff. C. Ignore if patient care was not affected. D. File a complaint anonymously online. Answer. A. Report to the nursing supervisor. Rationale. Falsifying documentation is an ethical and legal violation. Reporting to management ensures immediate investigation and accountability. Question 24. The nurse is caring for 4 clients. Which client should the nurse evaluate first after receiving shift report? A. A client receiving IV antibiotics reporting diarrhea. B. A client with COPD on 4-liter oxygen with respiratory rate 8 per minute. C. A client awaiting dressing change. D. A client asking for sleep medication. Answer. B. A client with COPD on 4-liter oxygen with respiratory rate 8 per minute. Rationale. A low respiratory rate suggests CO2 retention and respiratory depression, requiring urgent assessment. Question 25. A nurse manager receives multiple complaints about a staff nurse's rude communication with patients. What is the most appropriate first step? A. Discuss the reports directly with the nurse in private. B. Document and send the report to HR. C. Reassign the nurse to night shifts. D. Call a team meeting to discuss professionalism. Answer. A. Discuss the reports directly with the nurse in private. Rationale. Direct, private feedback allows correction and coaching before disciplinary escalation. Question 26. During a power outage, which client should the nurse prioritize first? A. A client on TPN via infusion pump. B. A client with a tracheostomy and oxygen at 2-liter minute. C. A client receiving IV antibiotics. D. A client awaiting discharge paperwork. Answer. B. A client with a tracheostomy and oxygen at 2 liters per minute. Rationale. Clients with airway needs are priority during power loss since oxygen delivery or suction may be compromised. Question 27. The nurse receives a new order for a medication dose that appears unusually high. What should the nurse do first? A. Hold the medication and verify with the provider. B. Administer the ordered dose. C. Ask another nurse if the dose seems right. D. Document medication held only. Answer. A. Hold the medication and verify with the provider. Rationale. Verification protects client safety. Nurses are accountable for safe medication administration. Question 28. A client with advanced dementia refuses morning medications. What is the nurse's best action? A. Coax the client until they agree. B. Document the refusal and notify the provider. C. Crush the medication and mix with food secretly. D. Ask the family to force administration. Answer. B. Document the refusal and notify the provider. Rationale. Clients have the right to refuse. Forced medication violates autonomy and legal rights. Question 29. A nurse is planning care for 4 clients. Which task can be delegated to a UAP? A. Assisting a stroke client to ambulate for the first time. B. Obtaining vital signs on a postoperative stable client. C. Teaching deep breathing exercises. D. Assessing bowel sounds post-surgery. Answer. B. Obtaining vital signs on a postoperative stable client. Rationale. UAPs can perform routine tasks. Assessment, evaluation, and teaching require RN judgment. Question 30. A nurse is leading a team during a code blue. Which action reflects effective leadership? A. Taking over all tasks personally. B. Assigning clear roles and communicating updates. C. Calling for additional staff without delegating tasks. D. Waiting for the physician to arrive. Answer. B. Assigning clear roles and communicating updates. Rationale. Leadership during emergencies involves delegation, coordination, and real-time communication to ensure efficiency. Question 31. A nurse receives an unsafe assignment with more clients than usual. What is the nurse's best action? A. Refuse the assignment and leave the unit. B. Accept the assignment and document concerns in writing. C. Report to the charge nurse and complete an incident form. D. Continue working and report later. Answer. C. Report to the charge nurse and complete an incident form. Rationale. Documenting and reporting unsafe conditions protects clients and the nurse from liability. Question 32. A new nurse reports feeling bullied by a senior nurse. What should the charge nurse do first? A. Tell them to ignore it. B. Arrange a private mediation between both nurses. C. Document and report to HR immediately. D. Schedule a public staff meeting to discuss. Answer. B. Arrange a private mediation between both nurses. Rationale. Early conflict resolution promotes teamwork and a safe work environment. Documentation follows if the issue persists. Question 33. A nurse manager observes multiple medication errors during shift changes. What system-level intervention should be implemented first? A. Introduce a double-check handoff protocol. B. Increase staff workload. C. Punish the nurses involved. D. Remove all new graduates from the shift. Answer. A. Introduce a double-check handoff protocol. Rationale. Improving processes, not punishment, addresses system causes and enhances safety. Question 34. During interdisciplinary rounds, a social worker disagrees with the nurse's discharge plan. What should the nurse do? A. Reiterate assessment data supporting the plan. B. Leave the discussion to avoid conflict. C. Insist that the nursing plan takes priority. D. Escalate directly to administration. Answer. A. Reiterate assessment data supporting the plan. Rationale. Collaboration is based on objective data and mutual respect. Presenting evidence supports professional advocacy. Question 35. The nurse finds a UAP transferring a weak client without assistance. What should the nurse do first? A. Assist immediately and ensure client safety. B. Document the incident for later review. C. Report to the manager immediately. D. Ask another nurse to intervene. Answer. A. Assist immediately and ensure client safety. Rationale. Safety is the immediate priority. Feedback and reporting follow after addressing risk. Question 36. A nurse is caring for a post-op client who refuses to ambulate. The family insists the client be forced to walk. What is the nurse's best response? A. Encourage but respect the client's right to refuse. B. Allow the family to motivate physically. C. Insist that ambulation is mandatory. D. Document refusal only. Answer. A. Encourage but respect the client's right to refuse. Rationale. The nurse must respect autonomy while promoting health. Coercion violates ethical principles. Question 37. Which action demonstrates effective risk management by the nurse manager? A. Reviewing all incident reports for patterns. B. Blaming staff for repeated falls. C. Reducing nurse-patient ratios without data. D. Delegating reviews to untrained staff. Answer. A. Reviewing all incident reports for patterns. Rationale. Identifying trends helps implement evidence-based prevention strategies and improves quality of care. Question 38. A nurse receives a verbal order for a medication that is not listed on the march. What should the nurse do first? A. Administer the medication immediately. B. Repeat the order back to confirm accuracy. C. Document and proceed later. D. Ask the pharmacist for permission. Answer. B. Repeat the order back to confirm accuracy. Rationale. Read-back verification ensures clear communication, preventing medication errors. Question 39. The nurse is planning client assignments. Which client should be assigned to a new graduate RN? A. Client with pneumonia needing discharge teaching. B. Client on telemetry with frequent PVCs. C. Client postoperative day 1 with stable vitals. D. Client in septic shock on vasopressors. Answer. C. Client postoperative day 1 with stable vitals. Rationale. Stable clients with predictable outcomes are appropriate for less experienced nurses. Question 40. A nurse caring for a dying client observes the family arguing about end-of-life decisions. What should the nurse do? A. Request a family meeting with the provider and social worker. B. Ignore the conflict to protect privacy. C. Choose one family member to make decisions. D. Proceed with care as ordered. Answer. A. Request a family meeting with the provider and social worker. Rationale. Interdisciplinary meetings promote shared decision-making and align care with the client's goals and legal documents. Question 41. The charge nurse must assign clients to an LPN and 2 RNs during a shift with limited staffing. Which client should be assigned to the LPN to ensure safe and effective care management? A. A client newly admitted with chest pain and awaiting cardiac enzymes. B. A client 2 days post-appendectomy requiring dressing changes and 4 antibiotics. C. A client with diabetic ketoacidosis on an insulin drip. D. A client requiring discharge teaching about home oxygen therapy. Answer. B. A client 2 days post-appendectomy requiring dressing changes and IV antibiotics. Rationale. The LPN can safely care for stable postoperative clients with predictable outcomes, such as wound care and IV antibiotics. Clients with new admissions, unstable glucose management, or discharge teaching require an RN's assessment and education skills. Question 42. During a mass casualty event, which client should the nurse triage as immediate priority? A. A client with a closed femur fracture and stable vital signs. B. A client with a tension pneumothorax and severe respiratory distress. C. A client with 30% body surface burns and stable airway. D. A client with an open abdominal wound and absent bowel sounds. Answer. B. A client with a tension pneumothorax and severe respiratory distress. Rationale. The client with a tension pneumothorax is in life-threatening distress and requires immediate decompression. Burn injuries and open wounds are serious, but not immediately fatal if the airway is intact. Question 43. A nurse witnesses another nurse documenting medications as given, even though they were not administered. What is the nurse's priority action? A. Report the incident to the unit manager immediately. B. Confront the nurse privately and discuss the concern. C. Document the observation in the patient's record. D. Notify the State Board of Nursing directly. Answer: A. Report the incident to the unit manager immediately. Rationale: falsifying documentation is unethical and unsafe. The appropriate step is to report it through the chain of command so it can be investigated per facility policy. Direct reporting to the board is premature unless institutional reporting fails. Question 44. A nurse manager observes conflict between two RNs about workload distribution. What is the most effective initial action? A. Meet with both nurses privately to facilitate open discussion. B. Assign tasks equally between the two nurses. C. Report both nurses to HR for conflict. D. Transfer one nurse to another unit. Answer: A. Meet with both nurses privately to facilitate open discussion. Rationale: conflict resolution should begin with communication and collaboration, allowing both parties to express concerns. Administrative or disciplinary actions come later if issues persist. Question 45. A nurse is preparing to delegate vital sign monitoring to an unlicensed assistive personnel, UAP. Which instruction ensures safe delegation? A. Record all results, and I'll review them later. B. Take vital signs every 4 hours and report any abnormal values immediately. C. Document only if all values are within normal limits. D. You can decide if the patient needs vital signs more frequently. Answer: B. Take vital signs every 4 hours and report any abnormal values immediately. Rationale: clear, specific, measurable instructions are required when delegating. UAPs can measure and record but must report abnormal findings. The RN retains accountability for interpretation. Question 46. A nurse is caring for 4 clients. Which client should the nurse see first? A. A post-operative client reporting incisional pain rated 7 out of 10. B. A client with a tracheostomy and gurgling breath sounds. C. A client with blood glucose of 120 milligrams per deciliter. D. A client due for discharge in 30 minutes. Answer: B. A client with a tracheostomy and gurgling breath sounds. Rationale: airway always takes priority. The gurgling indicates possible secretion obstruction. Pain and discharge tasks can be delayed until the airway is secured. Question 47. A nurse manager reviews incident reports and notes several recent medication errors involving similar drugs. What is the priority management response? A. Provide individual discipline to each nurse involved. B. Conduct a root cause analysis to identify system failures. C. Reinforce double-check policies verbally during shift meetings. D. Require all staff to retake medication exams. Answer: B. Conduct a root cause analysis to identify system failures. Rationale: management must focus on system-level prevention, not punishment. Root cause analysis identifies process gaps to prevent recurrence. Question 48. A nurse receives a discharge order for a client who expresses confusion about new medications. What should the nurse do first? A. Notify the physician to delay discharge. B. Ask pharmacy to counsel the client. C. Review medication instructions with the client immediately. D. Delegate discharge teaching to another RN. Answer: C. Review medication instructions with the client immediately. Rationale: the nurse must ensure understanding before discharge. Medication teaching is an RN responsibility and cannot be delegated. Question 49. The nurse supervisor notices that a newly hired RN consistently delays documenting care. What is the most appropriate action? A. Assign fewer patients until documentation improves. B. Provide targeted mentoring and time management support. C. Issue a written warning for policy violation. D. Report the RN to the Board of Nursing. Answer: B. Provide targeted mentoring and time management support. Rationale: managers should coach and support performance improvement before discipline. Immediate reporting to the board is not justified unless safety is compromised. Question 50. A nurse finds a client's family member reading the client's electronic chart. What is the nurse's best action? A. Report the breach to the charge nurse immediately. B. Ask the family member to stop and leave the area. C. Document the event and notify the provider. D. Allow access if the family member is next of kin. Answer: B. Ask the family member to stop and leave the area. Rationale: unauthorized chart access violates HIPAA. The nurse must protect privacy first, then report the breach. Relationship status doesn't grant automatic access without consent. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.